name's James Marks, Dr. Marks. I'm a podiatrist, but more especially, I'm the medical director here for the Wound and Skin Healing Center and HBO Center of Washington Hospital. So in 2016, all the wound care centers across the United States got together and obviously identified the challenges and the amount of growth in wound care and created this wound awareness month. And so we're excited to be able to participate in that. We want to share the information about our location, what kind of wound care center we have, and especially the support that we have from administration with the Wound and Skin Healing Center here at the Wellness Center. So a chronic wound is where we have a wound that essentially has not shown any healing stages at the end of 4 weeks and definitely incomplete healing at 8 weeks. And those are the kind of patients that are referred to the wound care center for our expertise in advanced wound care strategies. So our philosophy is complex wounds desire complex strategies, and that's what we offer here at the Wound Care Center. What we know nationally is about 43% of all wounds are pressure injuries, and then about 31% are diabetic foot ulcers, and then about 12% are venous stasis. However, at our wound care center, it's just, you flip that. It's essentially majority is venous stasis pathology. These are ulcers that are associated with venous insufficiency, leg swelling, lymphedema, people that have been traumatized and they have excessive swelling and an interruption between the communication between the lymphatic system and the venous system. Diabetic foot ulcers obviously are very well known. Most people have heard of diabetic foot ulcers. Most diabetics, if you really talk to them, they worry about amputation. And unfortunately, during this COVID outbreak, we've actually seen a 50% increase in amputations. The pressure ulcers we do see here, but we don't quite see as much as what is reported on a national basis. The other thing that's really a challenge is that about 7 million Americans right now are experiencing some form of challenges with wounds. And I'm not just talking about having an ulcer or a hole in their leg or their foot or whatever, but it's really financial challenges, social economic challenges. There's depression involved, and then family members. We actually involve the family members in their care because they're such an incredible support to have that support team for them. Our wound care center here really, from head to toe, takes care of those individuals that have chronic wounds, or maybe there's trauma that's been involved. For some reason this year, we've had more door injuries where people are slamming their car door into their leg, and now they're on a blood thinner and they develop a wound, and it's complicated because they're on a blood thinner. So it's kind of interesting. It's never a dull moment here at the wound care center because of all these different pathologies that we see and take care of. So wounds care specialists, and to be quite frank with you, our worker bees are really the nurses. The providers we have here, we have about 20 staff providers or ancillary help that helps us with the patients. And it's so critically important for them to help us identify what the particular reason for their wound, and then to be able to offer advanced therapies. So some of those advanced therapies could be debridement, which means removal of dead tissue. It could also mean application of what we call total contact casting. We use that a lot for ulcers that are on the bottom of the foot. We also use wound vacs, which is revolutionized wound care in general, because it expedites the healing process by about 50%. So in the old days when I was providing wound care in my podiatry office, we didn't have all these advanced therapies. We didn't have the technology. One is we couldn't afford it, and two was space. And what's really nice about our wound care center, it's safe. It's in Building 1 at the Wellness Cameron Center. It's well lighted. There's free parking, but more importantly, the people here are friendly. They develop trust and confidence to that patient, which is so important as far as the healing goes. The brain trust, or what I would call the network where everything kind of grows from, is really our front office staff. We have incredible front office staff. The phone rings off the hook all the time. They're dealing with that. They're dealing with trying to schedule interventional radiology or cardiology or endocrinology, all the different team players that we have. And that's what really puts this as such a superior wound care center. The other thing is we have 6 treatment offices or treatment rooms for wound care. And what I like to call about, because I'm a little bit on the fluffy side, we've actually taken that into consideration when we developed our wound care center. So people of size don't have to be embarrassed. The chairs they're going to fit in, they're going to feel comfortable in. Everything is geared for that patient that has, wound issues. We also treat patients that have lymphedema. A lot of times these are individuals who have these very swollen, grotesque legs. They don't know where to go. Sometimes they just think they have to live with it for the rest of their life. It's very depressing. They come in here with sweatpants on because they can't find anything else to wear. And we're actually able to provide them a treatment plan that we can't cure it. And in fact, we can't hit home runs for all patients, but majority of the patients leave here satisfied and they feel much better about themselves. So obviously we went through a lot of information here. We're really excited about having the opportunity to share our expertise at the Wound Care Center here. But it's interesting, everyone knows somebody who's maybe has a wound, has an infection, has a traumatic event that hasn't healed within that period of time of 4 weeks or 8 weeks. So what I would ask them to do is call us at the Wound Care Center for an appointment. You can always go to our website for more information, but also talk to your primary care physician. We have an excellent relationship with the primary cares in this area. We also have an excellent relationship with the emergency department. In fact, a lot of our patients are first introduced to us through the emergency department. So if you're challenged, you're frustrated, you're wondering when is this hole going to fill in and when is it going to heal, obviously give us a call. We're here for you.